I'd first start by washing my hands to prevent the spread of diseases and germs to my patient. Hi, I'm Caitlin McMillan.
Hi, I'm Gabby Owens.
Okay, I'm going to do a quick assessment on you. It'll probably take about 20 minutes or so.
Okay.
And so we're going to go ahead and get started. The first thing I'm going to test is the olfactory nerve. So I'm going to have you occlude one side of your nose and breathe in, and the other. Okay, nares are patent. Then I'm going to have you do the same thing again, but this time I'm going to have you close your eyes and smell something, and I need you to tell me what you're smelling.
Okay.
So go ahead and close your eyes and occlude one side.
Peppermint. Peppermint.
Okay, patient was able to smell on both sides. Next, I'm going to have you cover one eye.
Okay.
And would cover one eye and read the second column of blue words.
Okay. Diarrhea, sore throat, headache, painful urination, ear pain.
Okay, and do the same.
Diarrhea, sore throat, headache, painful urination, and ear pain.
Okay, patient was able to read appropriately with both eyes. Next, I'm going to test the cranial nerve 3, 4, and 6, which are the oculomotor, trochlear, and abducens. I'm going to use my pen light to do that. So first, I want you to look at my nose and follow the top of the pen light. Okay, and now I'm going to shine a light in your eye, and just look at my nose. Okay, pupils are equal, round, reactive to light, and accommodation. They are 4 millimeters and constrict to 2 millimeters when the pen light is shined into the eye. Next, we'll do the trigeminal. So I'm going to have you clench your jaw, and I'm going to feel. Okay, perfect. And then I'm going to touch you with something sharp and something dull while your eyes are closed.
Okay.
And tell me which sensation you're feeling.
Okay. Sharp. Sharp. Dull. Dull.
Perfect. Next will be the acoustic nerve. So I'm going to whisper a word into each eye, and I want you to tell me what word I'm whispering. Okay.
Doctor.
Cough. Perfect. The patient was able to hear both words on either side of her ears. Next will be the glossopharyngeal and the vagus. I'm going to shine my pen light in, and I'm going to have you stick your tongue out and say ah.
Okay. Ah.
Okay. Uvula is midline and rises and falls. She's also able to swallow. Next will be the spinal accessory, which is cranial nerve 11.
Okay.
So I'm going to have you push against my. Perfect.
Okay.
Muscles are equal bilaterally. And the last will be the hypoglossal. So I want you to, that's cranial nerve 12, stick out your tongue and move it from side to side. Okay. Tongue protrudes midline, and she's able to move from side to side. Next, we're going to do some sensation testing. The first thing I want you to do is to touch your nose and then touch my finger, alternating fingers, okay?
Okay.
The next thing is you're going to take the heel of your foot, start at your knee and rub down to your ankle, and the opposite, perfect. Patient movements are symmetrical. Next, we are going to do a sensation test on your 2-point test. So hold out your hands and close your eyes, and tell me if you feel 1 or 2 points.
1, 1, 2, 2.
And then I'm also going to have you hold out your arms again, and I'm going to rub something over your arm. Tell me which arm you feel the sensation on, okay?
Right. Left.
Okay. Now we're going to do the proprioception test, which I'm going to touch your toe, and I'm going to move it forward and backward. And so this will be backward, or forward and then backward.
Okay.
And now close your eyes and tell me which way I'm moving it.
Back. Forward.
Okay.
Forward.
Perfect. Now we're going to do some range of motion, we're going to do some muscle strength tests. So first I'm going to have you hold out your arms and go against me. Okay. Perfect. And now we're going to do flexion. So try to flex your arm, and then resist. Other side, same thing, flex, extend. Perfect. And And now we're going to do the grip strength. Okay, and then hold your hands out. And I'm going to resist, okay, and resist. Okay, and then I'm going to have you lay down so I can do your leg strength.
Okay.
So, okay, first I want you to resist, lift your leg up and push against me. Perfect. Okay, again, good. And do dorsiflexion towards you and plantar flexion. Perfect. Next, we're going to do the range of motion. I'm going to have you stand up. We'll start with the spinal range of motion.
Okay.
Get on this side. So I'm going to bend forward for flexion, back for extension, and then we're going to rotate, and then to the side for lateral. Perfect. Now we're going to test your shoulder. So I'm going to have you go up for flexion, back for extension, up for abduction, and across your body for adduction, sorry, and then behind you for internal rotation,
okay,
and then up for external rotation, okay?
Okay.
Now again on the other side, flexion, extension, abduction, adduction, internal rotation, and external rotation. Oh, perfect. Okay, and now we'll do your elbows. So flex, extend, supination, pronation. Okay, and then now will be your wrist.
Okay.
Flexion, extension, adduction, or abduction, I'm sorry.
Okay.
And then adduction.
Okay.
And now for your hands, flexion, extension, adduction, abduction. Okay, and then your thumb, flexion, extension, abduction, and adduction.
Okay.
So, and then we'll have you sit back down. We will do some range of motion on your legs. So I'm going to have you do your knees now.
Okay.
So you're going to go out for flexion, for extension, and then up for flexion.
Okay.
And then you're going to do the cross your leg for the internal rotation, and then back for external rotation.
Okay.
Again on the other side, flexion, extension, internal rotation, external rotation. Okay. And then I'll have you lay down. And we'll do the same thing with your hips now. So up for flexion, down for, okay, and then go up and rotate in for external rotation, and then out for internal rotation. Okay, and the same. Okay. Up. There you go, and in, and out. Perfect. And then I'll have you turn over onto your belly. Okay. And go down for hip extension. Perfect. Next, we are going to do the abdomen. So I'm going to just take a look here at her abdomen. Her skin is warm, pink dry. There's no lesions noted, no piercings, striae, or scars. Contour is flat. I'm going to take a listen. Bowel signs are active in all 4 quadrants. Now I'm going to palpate. So over here would feel the liver, and that would be the right upper quadrant. And in the left upper quadrant, I would feel the spleen. Left lower, I would feel the left ovary. And the right lower, I would be able to feel the appendix. So, and then I'm going to percuss. You can go ahead and stand up. We just have one test to finish, and I'm going to have you walk from there to me and back while measuring your gait. Okay. Perfect. Gait is steady and even, and the patient was able to complete all the tests. Thank you.